Hello everyone, today I will be giving you a hands-on presentation about Botox treatment. In the meantime, I want to convey some information to you about Botox. As someone who has been practicing as a private practitioner for many years, I believe that the trust relationship between the patient and the doctor is very important. I am one of them. Therefore, I always show the box of Botox to patients. I will be applying it for the first time without opening it, to demonstrate that we use original preparations. I always emphasize that the original product is a quality product and one of the high quality products currently available in the market. I show this. Right now, you can see the box of the product we are using. We are preparing it. Frown, please. Lift them up. As you perform these facial expressions, we aim to lessen or remove the lines that appear. Please frown your eyebrows once more. Lift them again, please. When marking these points, essentially, also, we are marking the spot on the muscle for the application. And since I have been working with this system for many years, the size of the points helps me determine the dose I will give as well. Let's lift it up, please, to the maximum. Let's raise it again. I want you to focus especially on these lines. My application technique and style are a bit different, so we will start seeing the effects right away. It'll take a week for the effect to settle. It will require about 10 days from us. But if you have a meeting or a social event right after getting Botox, you will be able to attend those events either free of your lines or with significantly reduced lines. You won't need to wait 2 or 3 days to see results. This is something we can offer you as an innovation that is likely different from what our other physician colleagues do, and we are starting now. Generally, our patients say that my touch is light. In a moment, we will ask Ms. Boku to describe how light my touch is by praising it. I do Botox applications, usually without any numbing cream, unless the patient insists on it. The needles we use are this is because they are fine, and perhaps my touch is indeed a bit light. And we have completed the application between the 2 eyebrows. I will show you the verification of this shortly, both regarding the forehead and the area between the eyebrows. We will really start to see the effectiveness of the treatment immediately. Yes, it does require a few days for it to settle perfectly in our technique, but at least we will have started this process with a quick beginning. And again, I will make an assessment by asking our patient to perform their facial expressions. If we have additional points, we can also do that without lifting the patient from the chair before finishing the treatment. Raise your brows, please. Lift your eyebrows up. There are 2 points you especially need to pay attention to here. Firstly, when I ask the patient to make their facial expressions, if you notice they can perform all their expressions. So when I say furrow your brow, they can do it. When I ask them to raise their eyebrows, they can do so, but the lines have begun to fade. In a few days, these lines will vanish completely. Our patient is still young, and the lines are not yet deeply set. In cases like this, we can observe that the lines seem to have vanished, as if they were ironed. I will be bringing back the same guests. I kindly ask you to be attentive. This is crucial for both the authenticity of the job and the diminishing of lines. Please raise your eyebrows. Try to stretch them as much as you can, to the utmost degree possible. Now, relax. Lift your eyebrows upwards. Look, he can do all his expressions. However, he doesn't have as many wrinkles as he did before Botox. Its effects are beginning to manifest now.